Hello and welcome to my dissertation proposal defense. My name is Denise Romero and I'm going to be doing my proposal on unlicensed and uneducated dental assistants creating a concern for patient safety. The problem of practice is unlicensed and uneducated dental assistants create concern for patient safety during dental office procedures because they have had no formal education for microbiology, disease transmission, and all the other complex duties that dental assistants do. As you can see on the right of your screen, the latest infection control outbreak happened in Pennsylvania on November 7th. An outbreak was notified to the news as well as the public agencies that patients were exposed from January 2007 to September 2018. Thousands of patients are going to be tested for HIV and hepatitis. This all could have been prevented with following infection control guidelines through education. It is important to discuss the evolution of dental assisting and the continued needed change. Dr. Edmund Kells first hired the dental assistant called the lady in attendance in 1885. The lady in attendance was hired so that women could go to the dental offices and get dental work done without being accompanied by the husbands. Eventually, Dr. Kells realized what an asset it was and eventually started training her to help him chairside doing various procedures. As we could see, this practice still exists through on-the-job training. Every state nationwide allows for on-the-job dental assisting, including California. Although there is an education pathway, most states don't require it. It is important to realize that dental assistants have a very important job to do. Their responsibilities include all the infection control in the dental office, which includes setting up and tearing down dental operatories for dental treatment, sterilization of instruments, taking x-rays, and various other sophisticated procedures. The problem is on-the-job training misses details that formal education doesn't. Formal education includes a very complex, rigorous curriculum that includes microbiology, disease transmission, just to name a few. Dental assistants in formal education are trained very carefully to be able to show the different competencies that each task requires. You can see this example of dental unit water lines. This dental unit water line has not been cleaned, so this deadly bacteria has been allowed to develop inside this line. If you don't properly clean these lines and allow the bacteria to build up, it could be disastrous. You could see the picture on the right of a little girl who had to have major surgery. Because on-the-job trained dental assistants do not know to clean the dental unit water lines, in Anaheim, California, there was a major outbreak. Over 30 kids had to be hospitalized because the dental unit water lines were not cleaned. It exposed children during dental treatment to this deadly bacteria that was antibiotic resistant. This little girl lost 3 permanent teeth and part of her jaw, and she was not the only one. The dental boards of each state govern and make the laws that allow the dentist and dental assistants to work. The legislation grants the authority to the dental boards to establish qualifications for licensure, licensing, what education standards there are. This dissertation will include a gap analysis of the different dental boards, focusing on the Dental Board of California. The California Dental Board does have an education licensing pathway called the Registered Dental Assistant. However, it is not required. On-the-job, unlicensed, and uneducated dental assistants make up at least the average is 35,000 dental assistants. we don't have any kind of exact numbers because uneducated and unlicensed dental assistants don't report to the dental board like registered dental assistants do. This also creates another problem because they have not been background checked or screened through the Department of Justice through fingerprints like registered dental assistants and dentists and dental hygienists are required to. The organizational goal for the Dental Board of California should be to require all dental assistants working in the dental field to have an education and licensing by the year 2025. The following video is an example of education pathway, the training that occurs in order to be able to set up a dental operatory. Uneducated and unlicensed dental assistants don't get this kind of formal training. This is a dental assisting school learning how to flush the dental unit water lines and set up the operatory before patient care. You could see that each dental assistant is very carefully going through each chair, setting up barriers, disinfecting the chairs before the patients come, and then putting on all the plastic, which is called barriers, that allows for the dental chairs to not be as contaminated. Dental assisting education allows dental assistant students to be able to practice on typodonts or mannequins before being allowed to work on patients. This is dental assistants removing bacteria from the lines. The dental boards will be the stakeholder group of focus. The dental boards have the authority over the dentists and dental assistants to require all dental assistants be educated. Ultimately, dentists have the legal responsibility over dental assistants working in the practice. The dentists also are the ones that determine the level of dental assistant they hire, whether it be an educated licensed RDA, registered dental assistant, or an uneducated dental assistant. Ultimately, it's up to the dentist. My research questions are going to focus on the dentist knowledge and motivation and understanding the difference to see if they understand the difference between licensed and unlicensed dental assistants, as well as the dentistry culture and context of their knowledge and motivation to require education and licensing, as well as what the dental board is going to require for the dentists as far as updating the levels to require dental assistants to be licensed and educated for patient safety and protection. It's also important to indicate to the dental board that not only is the dental assistant putting the patient at risk, they're also putting themselves at risk because they could transmit infections to themselves as well. The conceptual framework that I will be using is the Clark and Estes conceptual framework, and I will be focusing on requiring dental education, requiring dental assisting programs to be nationally accredited, as well as all dental assistants having to pass a licensing exam. My proposed data collection procedures will be administering surveys through probably a online survey and administered to dentists. The surveys will be emailed using an email link. The limitations of my data collection is dentists not being honest and answering in fear of repercussions from the dental board of having dental assistants practice outside their scope of practice. Thank you for allowing me to present my proposal defense.